Good evening. I want to take a moment to talk about our school community, about COVID-19, and how we make decisions moving forward regarding those two. Let's start with some common ground. I, like many of you, I'm tired of talking about COVID. I'm tired of talking about positivity rates and quarantines and masks. In my 22 years of school leadership, COVID has been the greatest challenge and an unsolvable mystery. When the state of Indiana told each school district to come up with their own public health plan to meet the challenges of COVID and stay open for children, over 300 school corporations were left to create over 300 different plans. Listen, we can share our different perspectives on COVID and how we interpret the data. As I listen to members of our new task force, a group of community experts, the consensus is COVID is real and it's evolving to be more of a concern for children. And masks slow the spread. That's their perspective from caring for COVID patients over the last year and a half in Vigo County. Really, what can't be argued is this. We must follow the quarantine rules as set forth by the Vigo County Health Department and the Indiana State Department of Health. We have recently released a document that outlines quarantine protocols, which have changed as our health experts learn more about the disease, how it spreads, and how vaccines can help protect us and those around us. Quarantines are a reality, and if we have to move to remote learning at some schools, it will be because of quarantine numbers and staff availability. It will be because quarantines, while helpful in slowing the spread of COVID-19, are disruptive to school. And so we must do what we can do to layer mitigation strategies when we have a high number of local cases and to keep our quarantine numbers low. Those tools we have to keep those numbers low are like layers. You've heard them. They're keeping your distance, washing your hands, staying home, and when you have symptoms, getting a test. And yes, masks. We know that masks aren't perfect, but the first question the health department asks when a person is positive is if they were wearing a mask. And the answer determines who is quarantined. The medical consensus is that they help contain droplets that carry the virus. When we look at the quarantine rules, no matter your view on how effective masks are, masks keep our quarantine numbers low. They keep our schools open. And so in times of considerable spread, like the past few weeks in Vigo County, masks will be a part of our school day. We've already seen several school corporations across the state go virtual for 2 weeks because of quarantines. Moving a school to virtual learning, trust me, is a nightmare. For teachers who have to pivot, for students who want consistencies, and for families who need to work and make sure their child is cared for. Our greatest fear is that we have to return to a corporation-wide virtual learning situation like we did last November and December. And again, that was a nightmare. We want to avoid what has happened in districts like Shenandoah, in Henry County, Maconaquah, in Miami County, and in Scott County in Austin, where parents were left scrambling to find childcare, or worse, choose to leave their young children at home while they work for 2 weeks. Just yesterday, Pendleton Heights moved their middle school and high school to virtual. The economic impact of making that move to virtual learning is terrible, and we must be proactive in doing all we can do to prevent it. Still, we're dealing with a virus that has changed our lives for almost 2 years. Even though our efforts may not be enough, we want to still do all we can to keep our kids in school. We're also seeing businesses in our area who are moving to masking simply to keep their business doors open and to keep people employed. So let's talk about how we make changes to our plan moving forward. I have convened a group of local medical professionals to join a new advisory team. You see their names on the screen now. This group's main question, the question that they're dealing with, is how do we keep kids in school? Their purpose is to come to a consensus about our plan the week before each school meeting. That consensus will inform my recommendation to the board, which we will share with the community the Friday before each board meeting. I will present that recommendation to the board at each board meeting, and if a change is needed, the board will consider a vote. At those meetings, you, the public, will have a chance to voice your concerns, your thoughts, your interest about that recommendation. It's worth noting that this group of medical professionals have a wide range of perspectives on COVID and how to slow the spread in our community as well as our schools. They are dealing with COVID every day and will help look at our school data to help us make a wise recommendation. COVID was a reality in our schools from the moment students and staff walked into our door this past Monday. As of right now, 49 of our students are positive. 143 students are quarantined. 9 of our staff are positive, and 11 of our staff are quarantined. Not all of these positive cases came in contact with our schools, and we work with the health department to gather the data about our school community. I believe, without those measures in place, we could be looking at a much larger quarantine number based upon quarantine procedures put forth by the state and our local health department. School corporations around the state that started with mask optional have felt the crush, literally the crush of these quarantines, and have had to move to requiring masks in order to deal with this reality. My hope for this video was that it would be helpful in trying to understand how we're making decisions and how we're going to try to move together as a school community, and what we're doing to try to keep kids in school. As I've visited schools over the past week, it's clear. It is clear that our children are happy to be back in school. I want you to think about this. This week is the first week of school where all levels, elementary, middle school, and high school, have been in school 5 days per week since March of 2020. Let's do everything we can to keep them there.